to you. Okay, because there's a lot of, you don't want to do the reaching over the table. That's bad for your back. Okay, so I'm going to take broad, flat hands, and I'm going to find the hip bones. Okay, so that way I'm not poking around being like, what am I trying to find? You're already there. Okay? Now the ASIS, they're the big hip bones, so you can actually hook right underneath them. And then you for sure know that you're on them. Because it's kind of a big bone, what if your finger's at the top of one and the bottom of the other? And then you're like, oh, it's all crooked. So to know that they're actually level, hook underneath the bone. So I find the bones, then I take broad, flat thumbs. This is a case where thumbs are okay. And you come up and underneath. Okay, and the broad, flat, make sure I'm not digging in where it can be uncomfortable for the patient. So I have an idea of where it's going to be, and now I want to expose that area. Okay, may I lift up your shirt just a little bit? And with my draping sheet, I'm going to start laterally, okay, because this is intimate area. So I'm going to start in the less intimate area and tuck underneath. If I need to pull down even farther, you go under the underwear as well. Okay, because there's no point in draping just one part of the clothing if you have to move both. Okay, eventually when we get to soft tissue and ultrasound, we'll be using different substances and gels, so this also protects the patient's clothing. Okay, and then I can pull up and tuck the rest under without having to touch the patient's skin.
So you're not really exposing this anymore.
Well, now I'm going to. First I just tucked.
Oh, okay. All right.
Okay, then I'm going to expose just that one area. Okay, and keep it as covered as possible. So there's like a tiny little patch of skin showing.
All right.
And then I'll find the hip bone again and the ASIS. And now I'm hooked up on it. You know, and I have like this much skin showing. Because I already, over the clothes, found where it's going to be. Okay? Okay, so I found the ASIS. Iliac crest is the anterior spine. So if we come up and around, that's our iliac crest. So everyone find it on yourselves. Take your hands, say, where's my waist? Sink into those love handles we all have no matter how thin we are, and sink down. And you're on top of the crest. And the top of the crest is about at your L4 spine level. Okay, so the ASIS and the PSIS, which is in the back, are going to be a lot lower than the top of the crest. So that's our crest. So, and it's uncomfortable. Okay, so I'm going to go into your side a little bit. Okay, and I'm going to come in and then come down. And then I found it. Okay, and I just have to lift the shirt a little bit to do it. And again, once that I found it on one side, I just have that one area exposed. Okay, and then I can just pull their shirt down afterwards. SIS again, which I already exposed.
Where on the lab was it?
Right on the bottom. That little paragraph.
Oh, number 2.
Okay, I'm going to see this diagonal line from his ASIS to his pubic symphysis. That's where the inguinal ligament goes, and I'll show it to you on the skeleton as well. Okay, so I'm going to go just medial and kind of inferior, and there's going to be a ligament. I'm going to use 2 fingers, press in a little bit, and go back and forth over the ligament, and you can feel that ligamentous tissue like we've done in the knee and the ankle. So if the ASIS is here and his pubic symphysis is here, I went here and I went that way, and I can feel the ligament, because the ligament goes like that. And it is a tender area. Don't press too deep, because underneath our inguinal ligament, a whole bunch of major arteries and nerves run. So if you press too hard, the patient will jump. You can relax your hands. Thank you. So that was the the inguinal ligament. Okay, next we're going to do the lesser trochanter. So the lesser trochanter, actually I'm going to show you guys right now on the skeleton. Okay, so the pubic crest and pubic symphysis is right here, because right here is where the other pelvic bone would approximate. And we went from the ASIS to the pubic symphysis, that's where our inguinal ligament is. So this goes like that, and see how it creates a big kind of gap, where a whole bunch of things go through. Okay, now at our pubic symphysis, right right below it, we've got that big hole. Okay? So, pubic symphysis, this part of it up here, the top part of the hole, that's our, make sure I'm saying it right, superior ramus. We are going to palpate this inferior ramus, which goes from the pubic symphysis to our ischial tuberosity. Okay? But in the process, we're also going to palpate the lesser tubercle. Now you say, okay, this is in the front, this is in the back, what are you talking about? So the lesser tubercle actually is really hard to palpate from the back. So what we do to palpate it is we externally rotate the leg. And this guy's hip capsule is too tight. But if we externally rotate the leg, the lesser tubercle actually comes forward. And then we can palpate it. Anyone know what inserts on the lesser tubercle? Psoas. Trochanter, they're the same thing, but yeah, I think it's a trochanter, sorry. Lesser trochanter.
Just checking.
Yeah, something I don't know. Tubercle, trochanter, bone bumps. Okay.
The small one.
Yeah, the small one, the lesser one. Okay, so if we externally rotate, it'll expose this area. Because the iliopsoas inserts there, if we get the patient to go into a little bit of hip flexion, we'll confirm that we're on the right area. Okay, so we're going to go into that next. Okay, so I'm going to palpate his right leg. So what I'm going to do is expose that leg. And I'm going to take this whole extra part of the sheet and wrap it around. Okay, and then if I need to pull up the shorts, which I will for this part, again, I'm going to tuck in, starting laterally, and if I have to go medially, I don't touch the skin. I lift up the clothes and tuck under. Okay, and then I may have to tuck under back here as well. Okay, and that you always have this between the legs, so that's why if I bring the leg up, patient modesty maintained. Okay, and we don't need to have it tucked up here anymore. Okay, so we're going to go from lesser tubercle to then inferior ramus. Okay, so what I'm going to do, I'm going to take your leg and kind of bring your knee out like this. Is that okay? Is that comfortable? Okay. Most patients can tolerate this position. There's some patients who can't, it's specifically if they have hip pathologies. Okay, so what I'm going to do, broad flat hands, it's a tender area. I'm going to start kind of distal. Get the patient used to my touch, and then come up a little bit closer. I can kind of feel it right here. I just want you to try to push into my hand right here. Good, I'm a little bit off, and come over here again. Good, and relax. Okay, so it's about right there. Now your adductors are right here, and I'm underneath the adductors. Okay, and I'm just going to confirm. Push it in my hand. Good. Relax. One more time. Yeah, right there. Okay, so it's right here, and again, his adductors are right here, and I'm kind of underneath him, and if I pressed a little harder, it would be tender. It's not going to feel very prominent to you. It's not like feeling the greater trochanter, which is going to be more obvious. Okay, so that's why you have to confirm with the muscle activation. Okay, now the inferior ramus, we're getting a little bit more intimate here. Okay, I'm going to move my hands closer to your hip. Okay, so this is on the femur. The inferior ramus is on the pelvis. So I'm going to go up really on that joint line. And if I sink in and go up, it gets a little bit harder. And if I move medially, I can feel it. Okay, and I'm just going to stop where the adductors come. That's far enough. Okay, so from the lesser tubercle, you're going up closer to the joint line, sink in a little bit, and then hook up. Sink in and hook up. Yeah, you'll just feel like, okay, my hands aren't going any farther. That's the ramus.
That's the inferior ramus?
Inferior ramus. Chastity. So again, I'm going to expose one leg. Wrap this around. If the patient's ankles get uncomfortable, you put a pillow here as well. Okay, and again, I'm going to start lateral to tuck and then come around. They're going to have to go up a little high here. Okay, so again, broad flat hand, I'm going to sink in and hook up. Those are your sits bones. That's the ischial tuberosity. So sink in, hook up. So I'm sinking in this way and hooking up this way. You can do it this way, but it's going to be more uncomfortable for the patient. But if that's easier for you to find at first, that's fine. But sink in, go up, sits bones. Okay, ischial tuberosity. What inserts on the, or what originates on the ischial tuberosity? Hamstrings. So if you press too hard, it's tender. Okay, so that was the ischial tuberosity. When I was up by the PSIS, I should have done the sacrum as well. So bring that down for a minute. I'm going to come back here. So once you find the PSISs, if you go down and in just a little bit, and then imagine the sacrum as a V shape, you can actually feel a very small divot where the SI joint is. The sacroiliac joint. So it's where the pelvic bones approximate with the sacrum.
And you said once you find the...
What you found PSIS, and then come in a little bit, and then you'll feel the divot. And it's, instead of like a circular divot like the PSIS, it's more of a shallow groove. And you'll feel, if you just go up and down like this, you'll feel the groove. Okay, and remember it's kind of a V-shaped. And if you're not familiar with it, that's why you check out the skit. CSI. Last one is gluteal tuberosity. That one's a hard one, or coccyx as well. The gluteal tuberosity, and you'll see on here, got our greater trochanter. What's this one? Lesser. Your gluteal tuberosity is a tiny little bump that's kind of in between those two, but at the same level as the lesser trochanter. So where is it? Right there. Right here. So you're not, it's going to be hard to feel through all that soft tissue, but it's called the gluteal tuberosity because that's where the glutes insert. So they start up here and they come around to here.
On the level of the lesser trochanter.
Yeah, it's kind of on the level of lesser trochanter, but it's between them as well. That's kind of how I remember it. So greater trochanter, I know the lesser trochanter is in there. I could have him lift up a little bit here. You just want to make sure the hamstrings don't get in the way. And relax. And if that's your ischial tube, I'm going to come lateral a little bit, and a little inferior, and it's approximately in that area. Just find the approximate area, and that one is fine. It's going to be hard to feel the bone. The gluteal tuberosity. Okay, last thing is the coccyx. You are going to palpate it, but you're going to do it briefly. This one is okay over the clothes. But you do want to feel for the sacrum. Okay, once you felt the SI joint. And then for the coccyx is the tailbone, and you're going to find it. You found it, you come off.